everyone, how are you going? David Johnson here from the Back Pain and Functional Movement Training Centre. Hope you're well. I'm going to have a very quick chat to you, 5 minutes I've got to talk about a very common condition that I manage, and spinal surgeons all over the world manage. Probably the most common spinal surgical procedure that we ever perform. It's called a microdiscectomy. Okay, microdiscectomy. Why is it called that? Because we use a microscope. And what are we doing? We're doing a discectomy. Amazing. Discectomy. And why are we doing the operation? Well, this is the problem that we're dealing with when we do a microdiscectomy. We're dealing with a disc prolapse, okay? This is a disc prolapse, and I've got a projection of an MRI scan. Here's a projection of an MRI scan. These are the lumbar vertebrae right here. This is the side view, and you can see these stripes going across the bone. These are the lumbar discs, and it's a side view. This is the bird's eye view, and you can there see the disc prolapse pushing out to that side, and the nerve root is sitting behind the disc prolapse and being stretched, so to speak. Here on the side view, you can see the disc prolapse mushrooming out of the disc space here, and here's the nerve root having to traverse over the top of this speed bump, and of course that creates the symptoms of neuropathic pain. Let me turn the light back on. That creates the symptoms of neuropathic pain. And what does that feel like? It's often described with adjectives such as burning, tingling, pins and needles, sharps, deep, severe aching pain. And that's often a clue to something irritating a nerve structure. Before the disc prolapses, the disc is actually unhealthy. You don't just get a disc prolapse out of the blue. Even though symptoms may develop out of the blue, the disc is unhealthy often long before it actually prolapses. So people often have a history of either chronic low back pain or relapsing and remitting niggly low back pain for months to years before it actually prolapses. And then they go and do either a trivial movement, or they lift or bend or twist, and then they get the herniation, and then their symptoms change to not only have the back pain, which is associated with the unhealthy disc, but because the disc is prolapsed, they now have the neuropathic symptoms or the sciatic pain symptoms. And why do we use the word sciatic? Because the sciatic nerve is made up of a fusion of all of these lumbar nerve roots here that fuse in the pelvis, and then they run down out of the pelvis and then down the lower limb to form the big sciatic nerve cord. And when constituents of that sciatic nerve are injured up here in the spine, it still gives you pain in the distribution of where the sciatic nerve runs. Okay. The most important message that I want to convey in this talk is that when we do this operation, it is a nerve operation. Okay, it has the sole function of taking the pressure off the nerve. It is a nerve operation, and it does that very, very successfully. Where we go wrong, or where patients go wrong who have had a microdiscectomy surgery, is that they are not informed, or they're not made to understand that this disc was still unhealthy. And if they have the microdiscectomy surgery and it's successful at eliminating the pressure off the nerve, the disc is still unhealthy. Okay, so the disc itself is still unhealthy. That's a very important fact. The surgery on the disc does absolutely nothing to make the disc healthier, okay? Microdiscectomy surgery does not make your lumbar disc healthier. In fact, when we do the surgery, we're nibbling away at fragments of the disc, so we're actually compromising the health of the disc, in fact, by nibbling away at this material here and the capsule and sometimes the fragments of disc that are just sitting under the surface here. So we're actually making that disc more unhealthy to some degree, but it's for the benefits of taking the pressure off the nerve. Okay, so we're making the nerve healthier, but we're not making the disc healthier. So half of the overall management, half of the management is for the nerve. What about the disc? We cannot leave that out of the management process. How do we make this disc healthier, and why do we need to make the disc healthier? Well, if we have an unhealthy disc, you're going to continue to suffer from back pain symptoms, okay? That's one of the major causes of back pain symptoms, an unhealthy disc. If you have an unhealthy disc, you can run the risk of getting a re-herniation, and then when it re-herniates, you get the nerve problems. You get the nerve problems coming back again. And therefore, what is an essential part of a microdiscectomy operation? It's functional movement therapy, okay? Because that is the rehabilitation, that is the specific and distinctive rehabilitation that focuses on the biomechanics of how these joints move. And if I can train my patients to have very good biomechanics after microdiscectomy surgery, then I promote the healing of the disc, I reduce the likelihood of a re-herniation, and therefore I reduce the likelihood of post-operative back pain or post-operative recurrent sciatic pain, and then I allow for that patient to return to their functional capacity, rebuild their functional capacity without the worry of the disc health compromising that. Okay, so take-home messages. A microdiscectomy surgery requires two things. It requires successful surgery, and the success rates of the actual surgery are very high with very low complication rates. But many people still report unsatisfactory outcomes, not because there was anything that went wrong in the surgery, but because they didn't engage in post-operative effective rehabilitation to make the disc healthier again, okay? Make the disc healthier again, because remember, the disc herniated because of a biomechanical stress in the first place, which I assign the term movement dysfunction, or the disease of movement dysfunction. And therefore, if that's what got me into the predicament in the first place and why I ended up needing the surgery, I have to eliminate movement dysfunction. How do I eliminate movement dysfunction? I eliminate movement dysfunction with functional movement therapy. Okay? Movement therapy is specifically to address the condition of movement dysfunction. And you can appreciate that core strengthening or fitness and strength and conditioning or stretching or massage will do very little, almost nothing, to improve movement proficiency. Okay? And that is the target of effective post-operative rehabilitation. Hope that makes some sense to you guys. If there's any questions, post it in the comments and I'll try to answer them for you. Otherwise, have a great day and I'll talk to you next time.